Hi everyone, I'm Dr. Z. I am a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you are new or regular viewer but have not had chance to subscribe, please do subscribe. It helps tremendously for a lot of other people find this content, and it is definitely helpful to me as well. So this is the best way to support the work that I do. If you don't yet follow me on Instagram and you are a trans woman, really encourage you to follow me on Instagram. Link is below. I create content, incredibly supportive, uplifting content for all of you on there, especially. And lastly, if you have not heard or have not yet been familiar with my new offering, Circle of Trans Womanhood, link is also below. Check it out. It's a great place where I have created a ton of specific workshops to help you detox imposter syndrome and work on inner confidence. And it's a great place where you have a chance to connect to other trans women from all over the world. There's a private group where a lot of women are being incredibly engaged. And there's also 2 live Zoom group meetings with me as well. So lots of things going on there. Check it out. Link is below. Having said that, welcome to our Q&A sessions. This is the place where you, viewer, get a chance to ask me your specific question and get some guidance, some insights, some feedback on it. So if you do have a question that you would like some insight on, please email it. My email is in description box below, and I will include it in the Q&A segment. As always, I blacked out anybody's identifying information. Timestamps are going to be below. And I randomly selected 4 questions. These seem to be really interesting questions. 2 of them, quite a bit of context. So I can't wait to dig into them. So without further ado, let's get started. Excuse me. As always, I'm gonna try to keep track of time. Okay, first question for today. Dr. Z, at the age of 53, I have just begun to accept that gender identity issues may relate to my depression, anxiety, and negative coping behaviors. Now, do I explain this? How do I explain this to my wife, who I believe will be supportive, and how should I prepare for the first meeting with a therapist? This is a great question for somebody who just became aware of their gender issues and how much it is related to their overall well-being. There is, as I always talked about this on this channel already, there is a lot of overlap with gender dysphoria, depression, and anxiety, especially. A lot of individuals realize that their anxiety and depression tends to either go away or diminish significantly once they start gender transition. That's because the culprit, the cause behind depression and anxiety was dysphoria. Yes, there are also people who have anxiety and dysphoria and depression as a standalone issue, and this is where a more knowledgeable professional can be really handy in helping you figure out what is what. Sadly, a lot of times dysphoria goes untreated, goes unrecognized, and individuals are end up being treated for depression and anxiety when the underlying root issue of it is gender identity. So that's the misdiagnosis happens quite frequently. So for starters, I think it's really important that you are at this aware place in your life where you're realizing how much of your gender identity issue is contributing to depression and anxiety, because awareness is super important. A lot of times people will go on medicalized treatment of antidepressants and anti-anxiety medication when that's not what's really needed, and that's not what's going to help them solve their problem. So that's really important that you are at this realization point. Now, how do you explain this to your wife, and then how do you prepare for your first meeting with therapist? So two parts to the question. In terms of your wife, who you already feel like is going to be supportive, as I always recommend, coming out is a matter of sitting down with people we care about and just doing that sharing. Now, if you're really anxious and really worried about how she might take it, or you don't want to overwhelm her, one of the ways that I found is really helpful for people to come out is to share that I've been struggling with gender issues. I come to realization that I need to do some more gender exploration, and I have come to realization that it has a lot to do with my depression and anxiety. This is kind of a generalized way of sharing. A more specific way would be, I know I have gender dysphoria. I also know that my gender identity is this, and I also know that I may want this part of a treatment. Sometimes being more specific can be very overwhelming when we first come out to people, especially people who are our partners, because it's almost like they're being presented with a lot of information at once. It's also so specific that partners can immediately feel blindsided. They can immediately feel like you've been planning this for a very long time without telling them, and suddenly they may start feeling like they were betrayed. So lots of things can come up. So I really think the best way that I found is just to ease into the conversation. Your partner might have a lot of questions for you. That is normal. Your wife might be asking you what your plans are, what does it mean, how long you've known. And if you don't have answers to a lot of them, it is completely okay to say, I don't know. I don't know. It's okay not to know. A lot of people feel that when they are in this process of coming out, that they almost somehow responsible for having all of the answers that another person is asking of them. The truth is, you don't have to have all of the answers, and chances are you're not going to have a lot of the answers, because a lot of the things is going to be unknown to you. A lot of the things are going to be uncertain for you. So just start the conversation going. Just sit down and start talking to her. So that's how you tackle that. How do you prepare for your first meeting with therapist? Um, when it comes to therapist, I usually recommend, well, let me put it this way. I personally, professionally think there's two things that matter the most when we are stepping into a relationship with a therapist. One is, are they knowledgeable, at least to a certain extent, with what I need help with? Because if they're not knowledgeable, no matter how amazing they are, no matter how great the relationship is going to be with them, if they really don't know what they're doing, it just might prolong your pain point. It might take things much longer, and they may also, by lack of knowledge, they may also, without intending to, may take you to places where you shouldn't go. So knowledge is important to some extent. And as I always say, it's going to be really challenging to find somebody who, like myself, for example, as a psychologist, have spent 20 years now only focusing on gender issues and nothing else, and only focusing on gender dysphoria. Somebody that incredibly specialized might be challenging to find, but there are so many providers right now who do work and focus on LGBTQ community, so that shouldn't be super impossible to find. And a lot of times, a lot of people don't really need somebody that specialized to begin with. So keep that in mind. And the second thing that I think is really important, apart from them being somewhat knowledgeable in what your concerns are, is what is your relationship with them? Do you feel like you are connected to them? Do you feel that they are understanding the depths of your issue? Do you think they are understanding you? Do you feel like they are also offering you good guidance, or do you feel that you are being heard in a session? The relational component is going to be very, very important, because again, if somebody comes, you can come to somebody who is a specialist as I am, but if you're going to absolutely not like in my delivery, not like in my directness, if you're going to just not like something about me, you're just not going to take in any kind of guidance or any kind of insight that I'm going to offer. So the relationship component is equally as important as having somewhat knowledge. So I recommend for you to not just think about you preparing for the session, but also you paying attention to Um, what are your thoughts about therapists? Don't be afraid to shop as a consumer for a therapist. And as a therapist you're sitting down with is not working out for you, don't be afraid to switch them. What to prepare for in terms of for you preparing for? Nothing. There's nothing you can prepare for. You're coming to a person who has been trained to understand the human psyche and the psychology and the development of the mind. And you're basically going to sit down with them and you're going to share with them, depending on what you're going to be comfortable sharing during that first session. I'm assuming you're going to share that you've been struggling with dysphoria or some history of these feelings, or any confusion about your gender identity that you have. Maybe you're going to want to share that I'm about to come out to my wife and I'm nervous about it. Can you help me with that? Allow, I guess maybe what I should have said is this in retrospect. I'm an organic therapist. What does it mean to me, an organic therapist? I don't like to super prepare for a session with the client other than reading any kind of information client has shared with me, because I know that if I set agenda for our session, for example, we're going to be discussing this, clients show up with what they need at that point in a time, and it's really important for me to meet them where their needs are. I can have an agenda to go over their gender history, but it's the client showing up in a particular session because they just had incredibly triggering dysphoria a day ago or a couple of hours ago, and they need me to help them cope with it, then I'm gonna drop looking into their history when that's the primary concern right now. So I have this organic, trusting that you will show up with what you need from me, and I will show up offering you what you need from me too. Type of process, the way that I tend to work with people. And I tend to work incredibly relationally with people. That it's something for you to think about. Can you also go with organic process? Meaning, instead of preparing to the session, can you trust that when you're going to show up, you're going to ask what you need and you're going to share with therapists what you need to share in that session. A lot of times people get very anxious when they're sitting in front of a gender therapist because they feel that I have to have my story right, I have to have my history right, because I really have to prove to this person that I am transgender. That's a lot of anxiety. You don't have to prove anything to anybody. You don't have to prove anything to anybody. And the therapist's job is not there to certify you or uncertify you as any form of identity at all. It is their job to help you navigate the things. It is their job to help you also clarify things for yourself. So that's what I gotta say about preparing for the meeting. It's just be you and just show up and trust the process. Great question. Hopefully things work out for you. And if you have already come out to your wife, and you're listening to this, sorry if this is a little bit too late, and hopefully your first meeting with a therapist went well too. Great question. Question number 2. I'm 48, married with children from UK, and have quietly suffered with gender dysphoria my entire life. I'm so sorry to hear that. I was raised in a right-wing household where I was under intense pressure to act masculine, find a girlfriend, get married, and live up to the expected role of a man. Only recently did I come out to my wife, and while she listened, she told me she may not be able to stay with me if I chose to transition. I don't blame her, but it hurts deeply. I feel like I betrayed her by hiding this truth for so long, and yet I also feel like I betrayed myself by suppressing who I really am. Now I'm afraid of being alone, of losing my family, and of what people who known me all my life might say or think. I've always felt insecure around other men, like I was only ever pretending to belong. I've carried this quiet pain for so long, and now it feels like it's finally overflowing. My question is, how can I be true to myself after a lifetime of hiding without losing everything and everyone I love? This is such a heartfelt question because it touches on what so many people are going out there struggling with. It touches on so many stories that I run into when, especially during my 15-minute free phone consult, when people call me from all over the world. This is such a common, one of the most common things is, what do I do now? How do I move forward? Like you said, my pain is overflowing. I can't contain it anymore. And yet I have accumulated all of this life. And yet I have all of these relationships. And yet I'm so scared to lose it all. But yet I'm losing myself in a process. So something is going to have to give. I don't know what it is. I don't want to be alone. I don't want to continue losing myself, but I also don't want to lose my family. It is a very, very painful crossroads to find yourself at. It is a very challenging place to be at. And I know that you feel like you have betrayed your wife and also betrayed yourself. And, you know, betrayal is a lot of you struggling with gender dysphoria, where it's almost like you were aware but unaware at the same time, because you were operating in this duality of, I know I'm struggling and I know that maybe I'm not comfortable being a man or being comfortable as other assigned gender, but maybe if this, or maybe that's not really what I think is going on, or maybe my mind is just making this up, or maybe this is just a fetish. In other words, a lot of you have been also in this duality, playing this, not playing, but having this mental justifications because you weren't yet fully ready to accept that this is really what's going on. And so I beg to wonder if you were not really fully consciously aware and fully certain that what you had was dysphoria and you were struggling with gender identity, how is that then a betrayal? As human things in a relationship especially, we do a lot of things. We rationalize a lot of things. And in retrospect, looking back, maybe those weren't the best decisions to make, but we're human beings, we're all fallible, and we're all operating from a feeling place. And I think anybody who's been in a situation you're in will say with certainty that their intention was never to hurt their partners. The intent was not to hurt, because clearly by staying and remaining in a position, you were also equally hurting yourself. So it's complicated. It is very challenging. So my heart goes to anybody in this situation. People always ask me this, what do I do? I'm so afraid everybody's going to leave me. That's a very personal decision to make. What I encourage you to think about, and anybody who is in this dilemma watching this, is what I encourage all of you in this kind of situation to think about is how, one, you have created this world around you, and yes, people know you as you, but at the same, just to speak, also part of you that was never accessible to anybody, including yourself. And so I encourage for you to think about your life and to think about how this big fear that everybody's going to leave you, how much of that is actually a very huge fear you're blowing out of proportion. Yes, some relationships don't work out. If people do transition, that happens. I see that it happens. And yes, relationships equally do work out. I see that happen too. What I do know is that for people for whom relationships don't work out, and sadly they have to move apart, even though they still love their spouses very much, they also have this other type of realization of how much healthier and better they feel, and how much more joyful and happier their life is. And like always say, some chapters in life just have to come to an end, even though you still love each other, even though you still care about each other. Sometimes still chapters have to close. We don't always close chapters in our lives because of falling out of love or somebody has done something wrong to us. Sometimes we love each other, but we still cannot be together. And this could be your situation too. also encourage for you to think about um, the possibilities are out there. I have worked with so many trans women specifically who have transitioned, and their biggest fear was, I'm going to be alone. I will never find a partner. And so many, by far, a very large percentage, in my practice that I work with so many people, do find a partner. Takes time, yes, but they do find a partner. And they're always surprised that they do. And it's like, well, why would you be surprised? I think there's this tendency to immediately see yourself as defective or broken through this lens of nobody will ever love me. And that is not true. Does it make it more challenging to date for somebody with transgender history? I would say yes. I think that that's an honest answer, but it doesn't make it any impossible. So I really encourage you to think about what you are going to gain, and also, you know, this is a hard situation because what is the alternative here? I want you to think about the alternative. So you're going to stay because you're afraid to lose all these people around you, but as you stay, your pain continues to accumulate and overflow. And what's going to happen then? If it continues to overflow, I guarantee you that pain is going to start causing you a lot of other issues, a lot of health issues, depression, anxiety, gastronomical issues, migraines. There's a lot of things that are somatically tied to living with gender dysphoria long term without doing anything about it. So if that's going to happen, how is that going to work? And also, if you're not really being fully yourself with people around you, that's just one-sided form of relationship. And I would challenge you to question whether you want a more wholesome relationship. Any big transitions and evolutions in life do come potentially with losses. I don't look at it as losses, honestly. I look at it as these people in your life, they have made relational contracts with you based on how you presented and from which point you oriented yourself. So if you were presenting as your assigned gender and they perceived you as a man, and then they also engaged with you on discussions and things that they thought would be of interest to you, and you went along with those discussions because you thought that's what you're supposed to do, to pretend to carry on being this idea of a man that you don't resonate with, that's a relationship contract you're building with these people based on part of you that is inauthentic. So when you do come out and you step into your own womanhood and those people decide to pull away, they're not abandoning you or you're not losing them. They're basically letting you know that, hey, the contract we had no longer stands because you're now a woman with transgender history, and I just don't want to be in a relationship with a woman with transgender history. If we can argue all day whether that's right or wrong, but I do encourage you to see that more as clearing up of a space for people to then be able to come in who are just lost pin on my pen. People to come in who want to be in a relationship with you, and trust me, you're going to feel such a relief having final discussions and conversations that are of interest to you, that are in alignment with you, versus trying to fit the mold that you're not. So I just encourage all of you to think about that. Anybody who's been in the situation, comment below what your experiences has been. The comment section is invaluable on this channel. So yeah, that's what I would recommend, but I wish you all of the best. I know this is a very challenging situation. Question number 3. I watched your channel since I basically knew who I was, and before I start, just want to thank you for all the amazing content over the years. You are so welcome. A little backstory before my question. So I'm trans or trans non-binary male to female, and I've consistently felt this way since 22. I hid in the closet because my sister convinced me, and I willingly walked back in because my mother was dealing with a lot of stress, my sister's stomach disorder, my late in-life autism, and schizoaffective disorder. I'm not sure there's misspelling, so I'm not sure. And my late grandmother's health. I came out as non-binary about 5 years ago, maybe a little more, but never felt fully non-binary. I still had a problem being male. Let's say a little over a week ago, my egg didn't break, it shattered against a brick wall. My mom now knows I feel like a woman and she's not taking it well. I've heard just this past week, she doesn't, mom's words, want the family unit. She works so hard to build broken up. If I change into a woman, I can't see my niece anymore. And I have to live with you because you're my son and we're family, but I guess this is a roommate situation and you're an adult. We went to I think it's New York medical doctor yesterday, and as my mom dumped all her emotions out, I got some validating looks from my doctor. We're setting up therapy mainly for me, but also for the both of us. I guess my question is, I know I want at least to get on hormones, and I want to know how soon I bring it up to my therapist. I do bring it up in the first session, or should I still wait till my second session? So thank you so much for sharing your question. I can see your dilemma. So you're 22. You've been identifying as trans, non-binary, toward femme side consistently, and you felt this way. Oh, since you're 22. Okay, so I don't know how old you are. You might be older than 22 now, but regardless, you're an adult, right? So um, you got to the point where now your mom knows, and your mom is really struggling with this knowledge. Your mom is struggling with this information. She's saying all of the things that is probably, I would guess, make you feel pretty bad about yourself. It's very hard to hear from a parent things such as, you can't see your niece, and you being you is breaking up family unit. That's very painful to hear, and it's very quick for some people to take those messages and internalize them as feelings of shame and guilt. And I encourage for you to first, I really encourage for you to start working on having a space between how you feel and your feelings and your mom reactions to things. Parents often have very challenging reactions, very difficult reactions when their kids are young adults. I'm assuming you're a young adult, probably in your mid-20s. This is by no means to justify your mom reaction at all, by no means. This is just to let you know that very common for parents to have reactions. Parents in general, I find, have this tendency, a lot of parents, not all, have this tendency of really having a very strong attachment with their kids, to the point where sometimes it can be, in my opinion as a psychologist, unhealthy when the kids is now an adult, right? When you are out there forming your life and forming your path and coming into your sense of identity, gender or otherwise, parents have a hard time having a healthy distance where they are recognizing, I am your parent, but you are also your own person. And yes, I have all these ideas of what I want you to be, but I also have to respect that you are your own person. And you may never be the version of you that I envision. And that's, to me, that's a very healthy parent who's able to hold the distance. Sadly, we see a lot more parents who are almost too entangled with their kids. Very common example, right? You're not my kid unless you go to medical school. You're not my kid unless you stick to your assigned gender. You're not my kid. And it's like all of the things. My goodness, I have definitely had to share that with my mom, with her cultural upbringing too. To this day, you've heard me say in the channel how badly I want to get a tattoo. I'm scared shitless. That's one of the main reasons I'm not getting it. But every time I bring it up to my mom, the message from her is the same. You're my child, I made you, and if you're gonna get a tattoo, I'm gonna skin the place where you're gonna get a tattoo. I'm 44 years old. 44. I pay for all of my bills. I live by myself. By this time, I fly um, to my mom's to take care of her when she has medical things come up. I'm taking care of her, and yet she's still having this attachment. So it's not healthy for parents to do that. But what's important is for you to realize that your mom is entangled in this attachment, and her feelings are her feelings. You're not responsible for her feelings. You cannot be an emotional sponge for her feelings. Yes, it is hard. Yes, it's not fair. Yes, she probably should not be saying some things out loud. Maybe she needs to be saying them behind closed doors. Maybe to somebody she can confide in versus putting it, unleashing it on you. What you can do is you can untangle yourself from her by recognizing that this is her stuff, these are her feelings, and recognize that as an adult you are your own person, and that this is still, in the end of the day, your life. Your mom is not going to live forever. None of our parents are going to live forever. If we're lucky, we're going to outlive our parents, right? Nobody wants to die early. So I really encourage for you to think about it, this creating this healthy distance from your mom, because if your mom is not able to create healthy distance, you can definitely do that. So your question mainly was, after I made this whole spiel, I don't even know if you needed to hear that. I hope this was helpful to you, because a lot of people get so riddled with shame and guilt, and it's like, don't take on somebody else's feelings. Like, don't take on your parents' feelings as adults. They're adjusting, they're adapting. Let them adjust, let them adapt. But your question is how soon to bring up that you want to start hormones with your therapist. You know, again, I honestly don't think that there is such thing as too soon or too late. With a therapist who is well-rounded therapist, somewhat versed in gender, mindful therapist, it's there's never too early or too soon. Now, as a therapist, what I can tell you is that if people on the first session tell me they want to start hormones, which as adults, I always remind them that they don't need my permission. We live in a world, there's a lot of informed consent clinics. I'm also not a medical prescriber for hormones. That there always are, you can go ahead and make an appointment with medical provider and discuss all the pros and cons of starting hormones and make the decision. However, because they're talking to me and I am a psychologist, and if they say, I want to start hormones today, I will at least spend some time just kind of talking about them, what are their expectations, making sure that they feel like they're ready and they feel like they also have things, how should I say it? Not that you need to have things in place, but you know, some people, for example, need sometimes to maybe do certain things first, or maybe need to address certain issues first. Or some people haven't really thought about that hormones are only going to do limited body changes, and they maybe have unrealistic expectations. So it's more about discussion, so that you then can take it and you can say, oh, okay, I still want to start hormones today, or this discussion informed me and maybe I want to navigate it differently. It's more about you making a better decision for yourself versus holding you back, or versus making you change your mind. A good provider is going to give you good information. A good provider is going to make you think about things you haven't thought of before, so that in the long run, they can benefit you in the long term. So don't be afraid to bring it up. I have never ever in my life equated somebody bringing up that they want hormones with anything other than that they want to start hormones. I have never thought they're being irrational, they're being quick, that means they're really not trans. If those are things you're concerned about, a good provider doesn't think like that. At least I consider myself a good provider. I don't. When somebody says, Dr. Z, on a first appointment, I want to start hormones tomorrow, for me it's like, okay, it looks like you have thought about it. Looks like you have thought about it and looks like there's an urgency. Tell me a little bit more about it. And a lot of times what happens is that people have a strong pain point, or people just ready. They're just tired of living their life inauthentically, and they're just so eager to start. And that's that's really important to recognize too, that you might be at that eagerness. You've been carrying this for a long time. You may be just ready to go. Again, keep in mind, if I read it right, New York mental doctor, New York has a lot of gender affirming clinics. You don't need a therapist approval. Just keep that in mind. A lot of people still don't know that. So they feel like they need to convince therapists to give them permission. I always tell people, you can start hormones without talking to me. Because that's really important to know. So keep that in mind. I wish you all of the best on your first session, and just your whole path and journey, and your whole relationship to yourself and your identity. Again, it's really important for you to have that healthy distance from your mom. Good question, and wish you all of the best. And finally, question number 4. I have a question. I think maybe on a lot of our minds as trans individuals, in light of recent events and a time of a lot of uncertainty in regards to the future of health care in the United States. Question: I'm 32 years old and discovered I'm a trans woman back in January and want to start hormones ASAP. See, some people, when they realize it's like, what am I waiting for? All very valid. There's nothing invalid about wanting to start ASAP. However, with everything going on politically, particularly the passing of the big BS bill, I'm afraid of starting HRT this year and then losing health coverage next year due to changes to the ACA and not being able to afford it. This is making me feel extremely anxious, hopeless, and like my life and transition are on hold until I know if I can still have access to gender affirming care next year. I'm afraid I will never be able to transition the way I want. Any advice for coping with these feelings and how to best move forward? Whew, this is a tough one, because there is so much uncertainty right now in the United States with current politics. Things are changing rapidly. Things are changing just in a very, very brutal way. You're not the first one to be really concerned about starting some things that you may not be able to have access to, or be able to continue, or be able to afford. This is a scary thing, and I think this is a scary thing for not just for individuals who are trans, who need access to medical care, primarily hormones. I think this is really, really terrifying for anybody regardless of gender identity, that has a medical condition that is dependent on medical assistance, that is dependent on access to medical care, period, whether it is in the form of medicine or other forms. Cutting that off is like cutting off a lifeline. We already know that. What I really encourage, and this is how I operate, I think that living in fear and living in waiting and prolonging the pain and prolonging your suffering is also not helpful. I think that an element of uncertainty when we're dependent on something is always going to be there. And in this case, it is a dependency, right? I think it's right to name it that way, dependency on access to medical care. And that's scary, because anytime we're dependent on anything like that, there's no guarantee. It can always be yanked away from us. Even medical care we pay for out of pocket, things just like that are out there are very uncertain and can just be yanked away. And yet one still has to find a way to live, find a way to move forward. In this kind of situation, I place a big bet on hope and faith. I place a big bet that I'm not the only one who needs this. I'm placing a big bet on the fact that there's still going to be a ways for people to be able to find and provide hormones and medical care, at least in the specific situation, because for many, many years, trans individuals have, even through very alternative, sketchy channels, still found a way to get medical care. Not always, but they still found a way. Be it black market, be it, um, stealing birth control pills from their partners, or borrowing. You just have to hope for the best. Uh, I hate to sound like I'm so hopeful and not being realistic, but this is your well-being. Like, this is your health. Um, how do you cope with it? I think coping is just taking little steps and strides. Now, I sometimes ask people to play devil's advocate and to examine very scary possibilities. Let's say you start feminizing hormones, and let's say down the road you absolutely have no access to feminizing hormones. What's going to be the worst case scenario? You get off feminizing hormones. Um, can you still then take care of yourself? And these are hard questions that one has to sit with themselves. But again, I cite on a more hopeful, and living in a fear is not really going to help anybody. You still have got to live your life. You still need to have access to care. So just think about that. But there's really, if you're asking me how do I cope with it until this administration is out, coping would be finding a healthier way to deal with any dysphoric feelings, such as exercising, practicing self-care, doing some kind of meditation or grounding techniques, any kind of self-soothing things that are going to help you to feel more centered and connected to yourself, versus so debilitated and so overcome with gender dysphoria. Those are the coping things that I would recommend. But you also don't know how long this administration is going to last. I mean, we live in a very unpredictable times, and you don't even know who's going to be the next person in charge. So think about all these things through. A lot of people are so afraid, and as a result of the wait and the wait and the wait, and it just becomes a very painful form of existence. So something to think about. I really encourage for others to comment below what their thoughts are, what their feedback is. Comment below, share your comments, your thoughts. This is really good questions. That's just something you have to either trust, and trust also that you'll be able to handle if you're gonna come to the junction when you're not going to have access to hormone. Can you trust you'll find a way to handle it, to deal with it? And only you, my friend, know that answer. Great questions. I wish everybody who asks these great questions, all of the best. If you have a question for me, in my email is down below. Send me your question and I'll include it in Q&A. Other than that, I will see you all next time. Goodbye.